I believe that individuals who receive care, and perhaps people who are caring for them, their families, are the people who are best placed to judge whether care is safe, person-centred and effective. Of course we can have measures for that, and we need measures, we need benchmarks, we need standards, but really the critical question is, did the person receiving the care feel that it was safe, person-centred and effective? So my focus in health and social care integration is to ask people to remember at all times that the person is at the centre of what we do. This time round there is a legislative framework, so in that sense there's a clear framework for action, and there are outcomes that have been agreed by Parliament which the integration partnerships are expected to deliver. But the real reason it will be different, I believe, is because we're working with everyone involved in this to ensure that the people who are at the front line understand the opportunities that health and social care integration presents to remove some of the frustrations that they have had. So distinctions between organisations, boundaries that are set by governance or constitutional boundaries, all of these things really need to go, and we need to practice a new long word called boundarylessness. Now if you can say all that, you're doing well, but really for the person receiving the care, the boundaries don't matter. In fact, they can be a source of real frustration. Let me tell you about my mum. My mum's an elderly lady with what we would describe as complex multimorbidities. Now to me, she's not a set of complex multimorbidities, she's my mum. But my mum gets a huge amount of help, she lives in Linlithgow in West Lothian, from the REACT team. And I asked her recently, who's in the REACT team? Now she could tell me their names, but the main thing she said about them was they're very nice. And I said, who do they work for? She said, oh, I don't know. Someone receiving care shouldn't have to work out whether this is a health service person, a person from the voluntary sector, a person from local government, from social care. That shouldn't matter to the individual. What matters to my mum is that, thanks to the REACT team, she gets to stay at home instead of going into hospital.
Thank you. You also talked about leadership this morning. What does that mean for you in terms of integration?
Well, it's absolutely critical that we understand that leadership happens at all levels. So some of us have job titles that make us sound as though we were leaders, but actually a job title that makes you sound as though you're a leader is not leadership. Leadership is the real things you do from day to day that make a difference for others, that create space for others to shine, that help people to work together, that show influence. Now, you see, people worry about power, that health and social care integration will mean that somebody has to give up power. I don't see it like that at all. I think power is infinitely expandable. Think of teaching your child to ride a bicycle. Today, I can ride a bicycle. Tomorrow, if I teach my child to ride a bicycle, then there are two of us can ride a bicycle. I don't have to stop riding a bicycle for someone else to learn. That to me is like the power of health and social care integration. If we engage with communities, with families, with individuals, we can help them to help themselves. We can work with them to co-produce the solutions. We can build on the assets in communities. That means that there is more power, not less. And really, I don't go around worrying about power. I think there's plenty of it to go around, and I think there's more to be had for everyone. And I think health and social care integration is really about vesting power in individuals.